agus bunstructure a haáil áte tron deomer seo agus tro Microsoft Teams. Bfuil a chula daine leine am leindin?
Edin clear.
Ja, gléfa. Tenuf cíneach go bhfuil na microphone acaf an gugé an dáchuit na hinne lun Teams acaf agus na hinne lun clúis acaf. Ma ha sib a géisteach sé bhíneige agus ma ha sib son blian na gustat in na hinne lun Teams acaf a bhain. Men dásig sin éirimi de chorliche dolkreiten is treurig le fachkel oorni. Takbelet.
Neerhaas als je tot tank uit stuur in de washoor son de geines gaat tips als je wordt morgen dan hem zo'n vrijuwigheid ordens en hu genu je moet toch niet gaan als je tankel je kunt du haar riewig als count gehullen niet als je tankel je kunt guru de makies de krias kunnen huwen son zwaantje hard gaan is als je kun je mich dag niet hakin dunige stech uit heen aan de krias krumchin fijn shi uit zonnes en nana. Als je tankel je zo'n hoskel haar geskulig er fucking hul kom ik had al makkelijk kwak geheim charnig. Als je tankel kun je zo'n Noor ma hakin in de show wie als een humor show wie rugige gaat kaarsnokken de hole son aan Eilean je kun je naar kutjoge skacht lest als een hakin kun je tot geen Griekjes sturig Gauws kun je een hoe kale gaum de woorden heen. Fianisch zien als een gemetia show je cool als shoe als kiak fiachni kial aan Eilean zal kaarsnokken richele kun je zo je graas voor naar kutjochers skummishin torgusig war as gach ni hashin gianu hu pianach ar nech carox ar nech carox kum hu chorus en upper had het gianus had de strie fiachen die tokasuas ar koishnokken is fiachen die urgency janu huf shu kum hu chorus gach lest sa hake is in African akin kutjoch kum hu chorusen als kom je komen in maar beil ik en einmal shows spianig David McCloud ha pakeleria gastjoi daichet blione tot service kan nog gewoon als een kun je komen is as no watchen ha hossach hier ze kun je komen maar huis nog kun skach nie as een kanjoches kointje as na watching a show, kom ik huise je raas voor naar Gian zal kreas koren, gach nech wel fame oost. Dit al hosse geworden is, van meester peken skach juist. Amen.
Ik takbelet de oor. Chonju an est ga kwarig. An a daim die stuurdig na konju chudin na lennis na kuine. Ma ha sef nas bailt an chomedy agus frielig der computer fakaf camera eid agus microphone ye. Ma ha offigid na frielig der computer fakaf ye an dachut mar eilse we bien die ask no a fikkerst kist. Chudin an goine bwyl agus offigid an gowel system feus an jaumbar. As mach gecharliche in a mics. Ha maak a chietene ha feo a beulske goanje, agus bi an gaur oanjen an stad. An oa likes an garige a stui maak aurichi a maak gujarak. Ga vi ach da wak ek en naam. Ma ha se son tilleke kist vakev maak eet, agus ma ha offeke in a bien die as chorlichen alef an nurut a jano. Het pianwaches a horste wuile chomedy. An a daim die klarig uig, femig buil en jouwmer akel no kiege goeie jeestig wo ver a welchef. Het kusbretige gaal, ek tidde na konju agus a hilig e an offike immegi agus na buil begoorste gaag a konju aka. Goeien kutjach na kunje gewil a konju e klarig agus be e larig line korle a steu na konju. Zijn echt immerig. Het David McCloud kan als television korle a lekel agriach en jachken zo en die ta ich het bleven a kopingen korle. As Lena comedy bevalum Tangehorst de Ivy son Eichel is a yielchach an the Goochla Griach Carnam Leonichen, agus as in a guya she is sonnesgoot an the vi elikel yet de Griach agus. And me hene de vikama eoloche, Davy is on, da ichet Leonas and Kutuch agus Tiffine, and me govika veindre. Bevalm fáilte chuéise meistis com fiisial chun choniu agus meánéach thuíochuig mar cheanar stúr I séhis an cóla, a sin an dúil a bhí a cuppi cála dút tro opaid chometí cála agus bunstructor agus opaid go má furasta an goteach. Lífa agus tachbalat da bhí son. Nópa jaudí anú fat imimeach blian. The high person the kuitach bang board. I was fiach a bishop boog, this never set on a house can kuitach, I be kisten day of Sabia. Nest Ger Hunderson, here there Ger Hunders na conyo age, Hogela fichet in Dulton, Davil, agus Kate, Richet, agus a shower son Undachug, Vishu Gundachug. Dachbeleef, Dalla Kusper, Ger Hunders conyo height, and a Shiawa fichet in Yiplein, Davil, agus Kate, Richet, agus a Shen son Fisrachug. Agus a dreskus per Gerhundus kunnu haitans nichet a lot in dultin Davile agus Kede richet agus a Shennuson fisrige kutuch. Nest Gerro kusper klare guid ma ha ujek buil an a guspersten bi e klar opbruch begorgaif senne klare. We ga veel mal na nisig buil an over e de wil ja te klare uid is gusper. Jörn is buils in jou marsenian undraastel vi kun microphone no as Teams le via klech en boeten toker live vechkentanja ten of kindig gewelche ka enemige geest rongus per emigi aus gewelche valentel en glech maar de gij a wenige zonje altenje klare goes rit me kewel. Nest bevalm fáilte chuéis níamach cra manager compart as haintrans chun choniu. Gef sin tasbennig fá meistid mach cra opid buin oproch call agus láinde. An dúin dasbennig bí corm ag buil kisten a hogar. Dag belet Daniel. Your microphone.
Thank you, Chair. And thanks for inviting me to come along to speak on this topic today. As the Chair said, I'm Neil McRae, Partnership Manager with Hightrans and based in Inverness, but I'm originally from Skye, but I have in Ushton and also Ronald Robertson. Two Ushchucks as my boss, so you can't have it all. Yes, if I just move on to the next slide. Thank you. No, it is working. Good. Yeah, I'm here today to speak specifically about our work on the Western Isles Transport and Health Working Group, but also about wider work in relation to access to healthcare. If we went back maybe about 10 years ago when I started working with Hightrans, access to healthcare was certainly an issue, but there was very little in the way of work looking at it and the challenges around it. So I think it's reflective of how it's increased as an issue when you see some of the work that is being looked at in the course of this presentation. Just moving on, first of all, to the Western Isles Transport and Health Working Group. The Cabinet Secretary for Health, Neil Gray, met with local patient representative group and stakeholders on the 24th of August. It was at the request of the Benbecula Patient Participation Group that the meeting was called, and there was a variety of key local stakeholders there from the NHS, the Comhairle, some of you obviously in the room here, but also wider bodies too, looking at the challenges faced particularly in relation to accessing healthcare for residents in Barra and North South Uist and Benbecula. As a result of that meeting, there was a number of actions, and Hightrans were asked to chair a short life working group, which commenced with its first meeting just last month. And the Minister set the terms of reference for this group, which, just to pull out very simple objectives there set out in the slide, and that was that the group will consider the immediate issues and opportunities which have been identified across the Western Isles in relation to health services and transport, making recommendations for actions, and it was to do that by the end of this calendar year. You'll note also, the group will foster relationships to improve integration of transport provision for health services and consider alternatives. Well, I think we've already, hopefully you'll see through the course of the presentation, been successful on that front in terms of the collaborative work that's happened already. And then finally, I'll do just a brief couple of slides on the wider work that we had through Hightrans set in motion already earlier this year. So yes, moving on, the group met on the first group on the 8th of October. And what have we heard since? Well, we've heard more evidence about the particular problems being faced by patients, both through the patient group, but also in terms of just the challenges around the booking and organising of appointments. We've had multiple, as well as the initial meeting that obviously brought everyone together in the one room, we've had subsequent calls with the Scottish Ambulance Service, Eilean, Hebridean Airways and colleagues here at the Comhairle, who obviously manage the PSO, and we've also spoke to multiple contacts within NHS Western Isles, and we've got a number of additional meetings set in place as well. We've received lots of information which I'll share some of with you, but just move on to the next one. What have we heard? I think the first thing to say, which is positive, is that all partners are willing to try and achieve better outcomes. There's a genuine attempt by all parties to look at what their role is at present and whether there is things that can be done to improve the outcomes for patients. That said, I think there's acknowledgement that there is, as well as some of those solutions inevitably costing money, there's also operational and regulatory challenges that are faced that mean that sometimes the simplest of things can't be delivered. And I know that there is often frustration around those, but there is nevertheless, I think, a willingness to see if there's workarounds or whether a more strategic approach can change things. In terms of what we've heard, I don't think there'll be any surprises here to anyone in the committee about what the key problems and challenges are. It's the strategic links, the inter-island and the island to mainland, be that either the ferries, but also obviously the air links to Inverness and Glasgow. We have heard, and this isn't to make less of it, it's more, I suppose, shows the resilience within the local community that while on-island travel is undoubtedly an issue, I think what we've heard is basically through people being able to access a personal car or that of a friend, people find workarounds in order to get to appointments. So if it's on island, they can manage, but it's when it's off island and you're reliant on other services that it becomes a real problem. And we've also heard, obviously, transport is a means to an end, and people are travelling for a reason. The reason is health services in this case, and there has been evidence, obviously, over the years, and this isn't just something short term, but through the strategic approach to healthcare with obviously specialist treatment centres now, people are having to travel further for some health services than they would a number of years ago. So we've looked at those links, Benbecula to Inverness via Stornoway. We've heard of the challenges from both individuals and the NHS in terms of just being able to book some of the services, in particular the PSO, and we've also heard the challenges around the access for people from Barra to both Stornoway and Inverness, and obviously highlighted the importance of that link to Glasgow, but can talk a bit more about that later as we go through. So it's not all bad news. There are solutions sometimes easy to some of these problems, and we've been exploring them. The working group, as I say, we're right in the middle of it just now, and we've got several calls. I'm actually going to meet colleagues in the NHS Western Isles after this committee, and just to talk about explore some of the potential options. But through the information I've received already to date from them, and they've supplied us with a lot of invaluable information. We know it's not easy to shift clinics and to move things around in terms of agreements and practices already in place. We've heard from Hebridean Airways that there is spare capacity, so there is potential to shift more people. But we've found from speaking to the NHS that it's not always apparent or obviously available when they're trying to book it through the patient travel service. So we've got a meeting set up this week just to look through that, because I'm aware that previously the NHS patient travel officers were able to do more of the booking work themselves. We've also looked at some of the infrastructure solutions that could deliver improvements. The aircraft, as you know, is based for the PSO is based in Stornoway at present, and some of the reasons for that are obviously the availability of hangarage at Benbecula and the availability of fuel there, and that has dictated to an extent the timetable, but also in terms of the capacity of the aircraft, with them having to take more fuel on board. So we're exploring how that could be resolved. There's obviously, as I say, that's a solution that comes at a cost, but there are wider benefits to support any business case for that, because we've heard of be it the Coast Guard or other operators who would utilise the fuel there. So there is work to do with Eilean in terms of developing a potential case there. There's also, just on the edges, some of the things that often get lost, I suppose, in terms of solutions that, well, we're trying to solve the strategic stuff. There are some improvements on the edges that can make a real difference to people who are travelling. So that there are things, for instance, in terms of Stornoway Airport to the hospital. To me, there's a no-brainer there that you've got a small aircraft that isn't too dissimilar from a minibus in capacity. Can we not then replicate that in terms of the transport and have something organised? And how do we deliver that? That comes at a cost, but potentially no cost if we could work with the airline, that people can notify that there's a requirement for a taxi in advance. So there's something around that. It's organisational, but we're hoping that we could maybe do it. And to be honest, it's something that could be replicated for other services if successful. The majority of people who are coming off flights will be going to some destination in Stornoway. Surely it is within all of us to organise something that can be done more rationally to deliver a service, rather than having multiple taxis being booked for the same destination. There's also little things around patient care and improving the travel experience that could be done, and hopefully those will be reflected in terms of our recommendations. As I say, the NHS have supplied a lot of invaluable data, and one of the aims we've had in the group is to move away from the anecdotal to actually just the hard numbers to understand what are the movements and the volumes of people requiring access to the different hospitals. So you can see there just a snapshot from 2023 that there's roughly about 2,000 people for outpatient appointments. This doesn't include inpatient, but it includes outpatient appointments, accessing either Raigmore or the Euston Barra Hospital for including Barra patients. The figures I don't think include the people from the US who are attending Euston Barra, but you can see there the numbers that need to use one of the, if you like, the strategic transport connections. So that in itself has been informative, and we're sharing that information with the airline and just seeing how that can be married up to have as an effective a service to support that as possible. We've also had information from the NHS, both in terms of the breakdown of those 2,000 outpatient appointments by what the clinical need, and there's just a summary table there which shows that there's 54 different specialisms that people have had to travel for, but only 9 of them account for 3/4 of all these appointments. So it focuses into a particular list of clinical or clinic and clinical specialism there that we've been discussing with the NHS. But from the information we've provided, even for all of those, there isn't necessarily an easy solution to do things differently. But I think it helps focus in on where there might be opportunities. And the final table there is just to highlight the change in terms of how people have been moving between the Euston Barra and Stornoway, with patient travel bookings back in 2019. You can see roughly the same overall volume of people moving as there was last year, or for this year rather, for the May to September period in both years. But the switch there from roughly 3 to 1 from flight to ferry back in 2019 to the opposite way around in the early months of this year. So we've looked at that, and there's some reasons for that, obviously, but also more recent data would be keen on see if there's been a shift in terms of the last couple of months as well. So what are the next steps for the working group? We've challenged everyone to look at measures which are readily implementable and will make a tangible difference to either a particular group of patients or any patient travelling. There's been one positive success already through representations raised about the patient group, the urgent medical appointment protocol that CalMac facilitate, which was only available for people travelling from Eilean to mainland, is now available for people on island to island. So people from Barra or the US travelling up to Stornoway will be met with the same sort of compensatory measures from CalMac in the event of them not being able to travel if the ferry is full. So that is a real positive. And as I say, we're looking at the measures and trying to break them down by the, if you like, the easy wins, those that require infrastructure or service changes, and those that require changes to the system. I won't, just conscious of time, won't go into all the details there. You can see I've just highlighted part of the discussion that we're having with NHS, just as looking at trying to see what scope there might be to shift anything within the list of bullets there under number 2. But what I thought I would do is just move on to this slide, which is an attempt, I'm not sure if everyone can read, just with the scale of the type there, but it's an attempt to categorise, I suppose, all the different issues that have been raised through the working group to date. And we've classified them as in scope, possibly in scope, and not in scope for change. I suppose what that's really saying is short, medium and long term. The ones on the left are things that potentially could be delivered through operational changes at not necessarily a cost or a significant new cost. The ones in the middle are more substantial, but could be solved quickly depending on available resource. And the things in the right column are those that aren't going to be left, but we recognise that they're not going to be sorted by December. I'm really keen to hear, obviously, from members just their views. So I'll maybe put that slide back up at the end just to hear whether you think we've got them in the right category or if you think there's things that have been missed. But you can see the flavour of things that the working group are looking at with the conversations we've got with the different groups. Just a couple more slides to cover. We have got, just to highlight, so that the timelines of the group were set by the Minister, and it is just 3 meetings. So we've just had our second progress update with all the membership of the group, and it is our intention to report just the week before Christmas at present. So we have got a tight timeline with that, and you can see there who we've to report to, but obviously we'll be sharing our recommendations publicly as well. So in the first slide, you'll note I highlighted one of the things was the Transport to Health Delivery Plan. So just this month, and I suppose the next 2 slides are just to highlight where some of hopefully the more strategic issues and some of those that can't be resolved in the time frame could potentially sit and still be delivered. So the Scottish Government has published just a few weeks ago a Transport to Health Delivery Plan, and in that there is 19 commitments, most of which are relevant to the work of this group and wider work that Hightrans, and I'm sure the Council and NHS West and Isles here are working on. So there's the digital and healthcare strategy, looking at NHS near me and the potential for people obviously not having to travel further, and exploring how to utilise that to its fullest, understanding fully that it's not a solution for every appointment. But there's some real tangible things in there that I think are really important going forward. So NHS annual delivery plans have to ensure patients have access to information and relevant patient transport. I think there's actually, it is from our experience working with other health boards, the patient travel service offered by NHS West and Isles is an excellent facility that really helps patients getting to their care. Improved data on transport health, you've seen some there. In general, there's nowhere near enough of this being shared for us to understand how we best facilitate the transport needs of patients. So the more of that is made available, the better. The government has pledged to review the patient travel expenses reimbursement guidance, and there is the last 2 or 3 recommendations there are really what I'm talking to you today about. So there is encouraging RTPs to set up action plans and groups across their area, which I'll just touch on. There's one round the accessibility of the Islander aircraft. So one of the issues that was raised by a number of patients was just challenges round for persons with reduced mobility getting on and off the Islander. So this, I suppose, is an example of where there's both strength in numbers and learning, shared learning across the region. We have the Islander aircraft has operated for 50 years in Orkney, delivering access to healthcare there. It also is operated on the Shetland PSO and in Argyll. So representatives from each of those councils and also the two aircraft operators, Airtask or Hebridean, and Loganair have got together, and we are actively working on a solution. In essence, it's how do we have a simple lift, but it has to be something bespoke, and it has to be something that can be rolled out at potentially, I think it's 15 airports. So can it be something that could be contained within the aircraft? Is there any resource and requirements that are needed? So what looks like a simple issue is still something that is going to take a wee bit of work to identify the correct solution, but we're actively working on that. And then there's a recommendation finally around this working group. So just finally, just to talk on the wider health and transport action plan work that Hightrans are undertaking. We've just updated our regional transport strategy. Access to healthcare, as I say, came out as a key issue. And to reflect those common challenges, we've tried to establish a health and transport action plan similar to that currently operates around the NHS Grampian area with the two local authorities there in the northeast. So we've engaged with, and you can see obviously the geography that we're looking at here. On the left there are the Hightrans 5 partner council areas, and on the right the NHS boards that have a same either matching or overlapping territory with ourselves. So there's NHS Western Isles, NHS Highland, NHS Orkney, and also NHS Murray, NHS Grampian, where Murray Council is. And finally, what does that work? So we've started initially. We had a meeting with all the NHS chairs just to understand the appetite for a working group, and we've commissioned a small piece that looks at what would this group focus on. And you can see the scoping review spoke to all the key partners, and what emerged as the key priority, again, while there are things that can be done, and I think undoubted improvements that can be made in terms of transport and public health and keeping people healthier for longer. These include things like active travel. There's also looking at how NHS staff travel more efficiently. But the top one that came back loud and clear is obviously around access to healthcare, which this group is looking at already. There's a recommendation for us to establish a group for the area and for it to be extended to include Shetland as well, because there's a recognition from speaking to them that, you know, accessing the key transport, health specialist centres, be it Inverness, Glasgow, or in the case of Murray and Shetland, Aberdeen, is common to all, as is the travel and challenges for more local appointments. So there's a willingness there, but we've highlighted that if this is going to be effective, it needs to be supported by commitment from partners to take it seriously, and for there to be resource so that it can actually implement the recommendations. So that is enough for me. It's just to open it up for guess any questions, and maybe I'll go back to that slide, Chair, that shows the key issues. Thank you.
Dagblad, Neil, Kirstenek, Dennis B. Ian, Cloud.
Thank you, Chair, and thanks, Neil, for the presentation. Was there any consideration given that maybe it would be better switching to Glasgow for healthcare? We have at least one flight a day of a substantial capacity aircraft during winter and 2 a day throughout the summer, 7 days a week. Was that given consideration?
So yes, it was. I've been raised. Yes, Mike. Sorry. Yes, it was, and it was raised by the patient group in Barra. It's an interesting one. There's a couple of issues around it. So one is the waiting lists. The NHS have, explained to us obviously the service level agreements that they have with neighbouring health boards in Highland and Greater Glasgow, and there's quite strict parameters around in terms of those SLAs that are in place, and the negotiation of different ones is very complex. But a couple of the things that have emerged from it is the waiting lists in Glasgow are so long, much longer than the Western Isles, that there isn't capacity there, even if people are able to travel. And there's also, I suppose, it's something that I would highlight, is, I suppose, the law of unintended consequences, that if totally understanding that the more attractive and easy option is for Barra residents to access potentially healthcare there because it's easier to travel. But if that is put in place, I suppose the long-term impact is that undermines some of the healthcare provision that is currently within the Western Isles, be it in Euston, Barra or Stornoway, or even more locally. So I suppose it's one of those things that has to be looked at, but I can totally understand from a patient perspective. But we've heard, I suppose, on the one hand, the NHS saying that it is, they're unable to do it, even if they could facilitate it. They haven't been able to, and also, I suppose, it's that longer term impact.
Ian Wilson, Taylor. Yeah. Lewis, academic.
Thank you very much, Chair. I'm not a member of your committee. Thank you very much for your presentation. I was thinking of asking the same question because recently I met a friend from Uist. I do have friends in Uist. We went for coffee, and he explained to me that he was up here for an appointment in the hospital, and he had just been told he was going to have to go to Glasgow. I said, why could I not have gone straight to Glasgow? And I've, as the chair will know, I was involved with the health board for a time, and I never really understood why it was the case that people in the south could not go directly to Glasgow. And the reasons that health have given you are a load of puff, quite frankly. And I would just disregard them. Yes, by all means, quote me. There is absolutely no reason at all why they shouldn't go to Glasgow. I myself had an appointment in Glasgow a fortnight ago. No issue at all. And so I think this, if the folk in Uist would like to fly to Glasgow, they should be allowed to fly to Glasgow, and that should be the bottom line. It strikes me as contortionists that they are having to be to get to the hospital here, and then frequently they have to either go to Inverness or they have to go to Glasgow. I just don't see that that's a good way of serving patients in Uist at all. And one thing I noticed you didn't mention in all of your discussion was the question of patient escorts. Patient escorts is an ongoing issue, and there have been some appalling decisions taken in the north. I don't know about the experience in the south, but there have been dreadful situations here where, elderly patients fearful of having to fly anywhere apart and then going away because they were ill and they were not allowed to have an escort. I mean, it's just bizarre because some mandarin in the office down in Stornoway decided they couldn't have an escort. It shouldn't be that way. We're supposed to be looking and caring about people. So you can give them that message too. Thank you very much. And incidentally, Hamza Yusuf, he said that he would sort it out for us, but he's gone elsewhere.
Ian, how she is a con you your list. So ha hier gaan nicht mehr mit you in it. Yeah. Could you the mic? Comhairle, Comhairle.
Just leave it.
Comhairle, yeah. Will it do records the Mr. McCaramack?
Should I put them back on? Yes, so I suppose, and that's the slide just before this one there was on, the data. And I think what I'm hopeful of is what we need to have is a transparency and understanding from everyone about what are the costs of the different decisions that everyone's making, and having the volumes there and understanding what the movements are. And then that also supports the business case in terms of what the health service are doing, but also what happens on the transport side. It's all a cost in the end to the public sector. So we just need to work out what is the most efficient way of doing it, and with the best outcomes for patients. It sounds easy, but it's getting to that point. But I'm very understanding. And just in terms of escorts, we have had figures with escorts as well included, but I do know that it is an area of contention in terms of who is eligible and who isn't, and the decision making around that. So that's something I'll feed back as well.
Perfect. Kumas, all the said. News.
No, thank you very much, Neil. It's a question of resource. I mean, it's the same with our ferries. It's a question of resource. And if they're prepared to pay, and they should be prepared to pay, why should we have inferior services to everybody else? Thank you.
I do.
Right, feel like.
Thank you, Chair. Just on this chart, on the possibility and scope for change, and down at the bottom there's better Stornoway Airport Hospital connection. I suppose that's all to do with cost, when you've got maybe 3 or 4 taxis running back and forth with 4 patients instead of having 1 vehicle.
It's not actually to do with cost. So my understanding was that pre-COVID, or maybe not even pre-COVID, there used to be a single taxi organised that would take all patients to it. But there has been a change in policy that through, and I'm hoping through meeting today, we can just understand it and maybe reverse it, because after all, everyone has travelled together in the same aircraft. So surely there shouldn't be a problem in terms of travelling the last 5 or so miles in a shared taxi. So
Yeah, and what I'm not seeing on there is the link between Leverborough and Stornoway. I mean, that is a high cost journey. It's for even someone who's contracted to do it, you're probably talking about a £250 return journey. I think that should be taken into consideration, because that's a high cost, and it's happening often where patients are coming across on the ferry and having to take a taxi from Leverborough to Stornoway and then back again later on.
So yeah, it hasn't been included in the slides that I have there, but certainly those costs, and as you say, it's 250, 300, I think, is what it's costing. So, if 2 are having to travel, is there a way that that at least can be shared? So yeah, it's exploring round DDA and confidentiality. Can we have a workaround there?
Yeah.
I was just going to go back, sorry, to the point that you'd raised in terms of, equalities. There was, I think, highlighted by the chair to me this morning, the Scottish Human Rights Commission had a study this morning, and it was looking at particularly the challenges around access in healthcare as something, so that is potentially an angle that we can use in terms of articulating the added resource that's needed.
Very much. I'm
not a member of your committee. I just looked at the Hightrans website a second ago, and probably in 7 years, maybe because I haven't been paying attention, I didn't realise that Shetland wasn't part of the organisation, and they will have similar issues as we have here, probably dealing with Aberdeen primarily. I think is probably the main hospital of Eilean, maybe Inverness as well. I don't know, is there anything we can learn from them, or maybe they're in a worse situation than us, or a better situation? I don't know. I know they've got probably a little bit more money than we have as an authority, but is it not good to learn best practice from somebody else where it's working? We have issues obviously just now with a smaller plane, access to it, probably more folk coming through Levermore, as Councillor Stewart has pointed out as well. But the whole issue around working together in perfect harmony with the health board seems to be a bit of a pipe dream, I think. I think we've spoken in this chamber previously about the benefits of a single Ireland authority and how things could possibly work better should we end up in a situation where we could manage sensibly the resources at our disposal collectively, if that were to be the case. But at the moment, it's not working. And we need a grown-up approach. And with the fear of possibly losing the services we have in our own hospital, it's difficult not to see the case where we're using a little bit of tokenism by taking them to Stornoway first before then sending them to Inverness and then sending them to Glasgow. I suppose an assessment has to be made of the conditions, etc. But a better streamlining of the service is probably a good idea. But then again, would that have a knock-on effect on the services that we're providing here within Stornoway? That's a thing in the Western Isles Hospital as well. We need to be careful of what it is we're providing locally, what we can provide locally, and what it is we're outsourcing to Inverness and Glasgow. So I think a whole joined-up approach with a collaborative working with the health board would definitely be beneficial, but it never seems to be the case that there's an invisible barrier there between ourselves and the health board. But again, there's only a finite resource, and the pressures on resources for us both is pretty daunting going forward for our budget setting process as well. The air service as well. The bigger plane was obviously the better option for people. We now have people who probably are in a medical condition where they cannot access the plane because of the difficulties of getting on board. So that's not great either. So yeah, I think a collaborative approach is definitely the way forward, and this is what you've outlined here. But we could definitely be doing better.
Yeah. No, thanks for those comments, and I think they illustrate what we're hopefully trying to achieve through the group. And you're right, in terms of Shetland, we work very closely with them. I won't go into the explanation as to why they're not in our RTP. It goes back about 15 years. But there are commonality issues. Their demand is split between like Aberdeen and to an extent Inverness, similar with Orkney. But it is round those accessing the key centres, and there has been changes there that have had a similar impact as to what has been experienced in the Western Isles. So I think by articulating our case together, it makes it a stronger case to government in terms of what should be done.
Could you have me son Ian you like all stay dosha no PS me you moch cast. Could you well something there?
Thank you, Neil. Excellent presentation and a lot of work done. You know, it's you say that you're going to finish on the 16th of December. I hope there is more. You know, that's only the start of things. I think there's a lot more, and it would be a shame if it stops at that, because you're really only scraping the surface, and you've highlighted what we have been trying to take to the fore for many a year, and hopefully something's going to come up what you're doing. And if I can help you and my colleagues, we'll do that. And I really look forward to your final, well, not your final hearings, but after the 16th of December. And our services are going back from what they were. You know, even if we could return to the level that we were at, you know, I think that's what we really need to be doing, because it is the vulnerable that are suffering, and it's the poor that can't get to travel to medical services. And if we can't provide that, there's something wrong in the system as a whole. So thank you, Neil, for everything. So
Apple sin sin ar carry. Mi corm Daniel the know who it is. Took a point hook going him Donald on het me and Guns of Gunilla. Vam uses the Helen and Farach in Trishak in Ganary Hakin. Is Hasen and the Siakama Coloch Dania for the fame Torgan Hazeland Hugol and the Danavark is on an hospital. I guess on the hand ten oostach chud dar a túgaif chan je lolach a tín fuidir golorog agus hata ha oostach for a bit in dal agus beat de sig an hospital in ha minibuses ach tiisiil sin de goorst agus a chulle kal chu kon mar sin chan je lolach fall af dolige fall af van na Heeslandje aatje fuidir golorogs wat mar sin agus ha choske sé go mal sies chan cat be down sin barach chotíag chan de peach sin a chotíag as a vías agus am jekultor so níos a go gile sin is áti gin eileh sin a haflig agus je sin an a seár.
Kom sabes ek dé ekelskully son tinne ja.
No, I couldn't agree more. And when you think of it, having the travel and accommodation sorted when you're at your most vulnerable, in effect, when you're having to travel for healthcare, should be the first place that we should have these arrangements in place. I know there is, I mean, thinking of the challenge round accommodation and thinking of that in terms of the healthcare and staffing side of it as well, which is a challenge in the islands. But there is obviously some provision in places like Comhairle Court at Raigmore, but it's having that available at standard and everything that should be part of a package in effect that people don't have to think it's provided as routine, I think is where we'd like to get to.
Tá sé chaning am na hélan in a fat kopi kon die hele mar hoorsin shaltin sarker sin hens mule aran mar sin be vid logan the enemy kitchen first gen nu na sarkas na hélan faroch is chaning ke behor a kopi kon die hele kutum klare vi an is irdes klare vi an chuige enige case schon Putin so de chosh kemaskepel de savli and of gana and the was launch it fat as an alape.
Vind je nes kro kiste like don't eat the on kutuch.
And you begin a tenor.
No, I don't. I took a note. Sorry.
Ti mich leis kenlich en is het me Dulite Senashik Nachtulans Davis Choye nach Ro Borsland it all yours to pay or son.
Oh, I should be an occasion.
Aye.
As on the hill for a patient travel, how we had to win the fan fistrach von garage post arm hit should have a choye. Now mine is at the Kaulamach in the kitchen, you know, the system on the Shana Bikinshig on the Chichika order Shan the Koskishin Dash man a ticket in the bag.
Yeah, I would say that's the most basic one that we can look to improve around the communication. It shouldn't come at any cost. So that's certainly, we've got a call between the NHS and the airline on Friday, and hopefully through that we can address some of the problems that patients have experienced.
Mustafa?
Thanks very much, and thanks, Neil, for your presentation. Just going back to the slide about patient travel data. Obviously, you have Western Isles Hospital, Rigmore, UAB. We know that some people are traveling to Glasgow anyway for different things. Is that possible to have that data? How many people have traveled to Glasgow instead of just Rigmore? And also looking at digging to see either from clinicians or from to see how easy was it to book it to Glasgow and the clinical circumstances around it, because you were referring to a long waiting list and the SLA, I think. So if people, it'd be good to see the number of people who are already traveling to Glasgow and the circumstances around it, you know, so to highlight. The other thing is, in terms of, obviously, this group has been initiated by the Cabinet Secretary. What commitment do you have from the Cabinet Secretary that your recommendations will be implemented and resourced? Is it just, you know, is it just buying time and talking about it, or is it going to be, do you have a commitment that they'll be implemented, and also resource not falling on the corner here, because we're looking at two different things. Obviously, the questions of health transport or patient transport, it's something that probably falls within our remit and we can do something about it. But also the other one is about healthcare delivery, which is purely NHS, and sometimes we're not in position to change that. But there are questions obviously that need to be raised about, within the context of like say small things that could be changed. And I think my colleague here alluded to that, the accommodation. We have a maternity experience, somebody coming from US to come up here in high season for the 2 weeks before giving birth, and it cost them £3,000. Now you get refunded £55 a night. That's a basic human right to give birth, and they can't give birth in US, so they have to come up here. You have to book for the first birth. You have to book 2 weeks in advance. You could be 2 weeks late, so they're booking for a whole month. But you only get reimbursed from the time once you get admitted to hospital, your booking is gone. You don't get. We raised that with the health board here, and they said, they look. I mean, basic things like that. You raised the example of Kyle Court. We have a nurses' quarter here. There is something that could be done around that for cases like that, to secure a package. You're coming up for care, your accommodation start outside hospital, taking charge, and also taking charge when you get into hospital. You don't need to pay £3,000. Not everybody from US can afford to pay £3,000 to give birth. It's and that's just a regular example. It's so it's what we're talking about. People, it's very expensive to be ill in US. So anyway, I'll stop at that. Pardon?
Yeah.
So first of all, just in terms of access to Glasgow, we do have some data on that. Part of this is just within the time frame. There's only so many different asks we've had, because we're obviously conscious that the NHS supplies us with a lot of information already. All of that, I think, needs to be understood a lot more, and the costs of doing things differently understood. And by that I mean just the example that you've said there. There might be a review of, in terms of redesigning healthcare, in terms of what that costs of moving NHS staff around for the clinic. But what I don't think has been understood is the costs that are borne sometimes by the local population in terms of distance to travel. And it's not just economic, it's the social and health outcomes that could potentially be from that, because we understand that if people are having to travel further, they don't necessarily go to the appointments in the first place. So I think there's a lot that could be looked at that, but I'm conscious obviously of the time frame that we've got for this. But hopefully this will be the start of the work, not the end. And in terms of the minister commitment, we've had, I think, the fact that's why I highlighted, they've just published their own plan in terms of, with 19 commitments. I think that shows that they've, we've certainly had their the minister's ear in terms of setting this up, and really strong support. But I am conscious that doesn't necessarily translate into, if there are a cost to obviously the solutions. But I suppose it's to say that we've had good support to date.
Ian.
Thanks, Chair. Thank you very much, Neil. Ian McCauley, Stornoway North. When I heard you mention that the minibus, because there's lots of taxis at Stornoway Airport, etc., it got me thinking. I knew somebody that came up once for an eye appointment, and because it was the eye specialist that was up here, 3 or 4 people were coming, and again, because it's something to do with their eyes, a lot of them had escorts, so they all make their way to the airport. They have to wait an hour for the bus, they have to book into the airport an hour beforehand. They fly up, they get their taxis, the same way, have to go back to the airport another 2 hours before they get home. Why could they simply just get a minibus or a bus from the hospital based in US to go down to collect all these people, take them across on the ferry. There's no issue with confidentiality because they're all going to be together on a bus anyway. It's going to be a door-to-door service. It's going to be a lot more cost-effective. The bus could have an ambi lift on it, so that's going to solve a lot of problems if people can't get onto the wee bus. It seems a much more seamless, straightforward, but maybe it's just maybe too simplistic about it all. I don't know, but it just seems a much more easier way of looking at it and less discomfort. They could even stay on the bus and the ferry all the way up. I don't know. Thank you.
Yeah, I totally agree. I mean, I know there are issues around patient confidentiality, but maybe if there was even something that people could tick as a waiver to that, to you know, and then those that have ticked it can be looked at collectively, you know, in order to find a solution for them. You'd think there are savings to be made, and that's certainly the angle we are coming at it. And as I say, if people are travelling up in the aircraft, and then going to the same destination, the chances are they're meeting each other at the reception anyway.
And they're on the same bus together.
Exactly, in the same bus together.
On the same plane.
So surely there's something that we can do around that.
Yeah, I think it would definitely a better service to offer the patient as well.
Yeah.
Thank you.
Gold.
I think you mentioned in your presentation that 9 specialisms make up about 75% of the required travel.
Yep.
Is that correct?
Yes.
I mean, has consideration been given to actually, rather than just focusing on the transport issues, actually focusing on the health issues? A lot of these specialisms will require people to travel, but there surely is a possibility where these specialisms can be brought to the people. You know, where clinics and consultations can take place actually in the community itself, so to reduce the need for travel at all. Has that been a consideration of the group?
It certainly has, and I think that should be the starting point for any of these decisions. Can the service be delivered more locally to the patient or the resident? There are, and I think if you start there and the business case is built up on that basis, it might be that we still come to the conclusion that some have to be delivered centrally and in specialist centres, but at least everyone understands why it's been done and the costs that are involved for doing it one way or the other. So yeah, I think that's certainly the among the questions we're asking.
Paul.
Thank you, Chair. Just going back to the point about the cost being borne by the US population. I was one of these that was up for 4 weeks waiting for the birth of my child. It's a lot of money we're having to put out. Again, this is very specific to people who live in US and Barra. It's not really experienced by people in other places across the country. So I'm just wondering in terms of island proofing the legislation for the circumstances that have been covered by lots of people today. I mean, I agree with pretty much the majority of the points that have been made by fellow members today. The other thing I was going to mention was in terms of it's not just Glasgow or Inverness. We've got people travelling to Edinburgh. So I've got a patient who's been in touch, not been able to work because they've been ill and they're having to go for regular checkups. They're not able to actually afford. So they're thinking of not going to that appointment because they're not able to afford to go there. They'll get some of the travel paid, but they can't afford to stay there because they've got to claim the money back. So if people aren't accessing healthcare because they're not able to afford it, that's putting people's lives at risk. And I think we just need to be aware that's the situation. People are in that situation right now. So this work is, it's great that it started. I'm glad that we've taken it forward. It should have happened a long time ago.
Just to say, I agree. Island proofing, and we mentioned earlier this Scottish Human Rights Commission. It's maybe just how we articulate this need, and we'll certainly think about that in reporting. And you're right. I mean, I've highlighted the main ones. We've had examples of people having to travel to Falkirk as well. It's not just Glasgow and Inverness. So there's a lot of challenges.
Thanks. And seeing as I left my light on, I might as well say so. And I was touched already. If the flight's cancelled, and then you're having to find extra accommodation, it's great when Loganair sort that out. It's not always the case if it's a ferry that's cancelled. So yeah, thank you.
Thank you.
Say that. Wat is ontillig, Mustafa?
No, thanks. It was just obviously a point I think Councillor McCormick highlighted at the beginning, which I think the leader just alluded to it as well. It's about escort. I think escort play, especially from youth and Bara, play a big part in healthcare delivery. And I've seen people not going to appointments because they were refused escort. And the simple things is, in the past, escort were signed off by the clinician that's overlooking the treatment, the GP. And for whatever reason, the health board decided to centralize the escort. So you need to be authorized by the chief executive or the medical director, which makes it more difficult for. So if we could go back to simplifying the escort requirement and leave it to the clinician that's overlooking the treatment, that knows the patient and knows what their problems are. So I think that will be a help. Yeah, that's the thing. So thank you.
Cool me, yeah.
Okay.
I was just going to say, I wasn't aware of that, so thank you very much for that. That's interesting information about how escorts are booked.
British up.
Okay.
Right, Gordon, Eilean, yeah, Gordon Murray.
Many thanks, Chair. Many thanks for the presentation, Mr. McCrea. I found it very helpful. I think it's fair to say that inter-island air travel has never been the same since the Comhairle cut it many years ago. And I would just wanted to ask, has there been any progress on synchronising timetables between health professionals with the air service so that clinics can be maximised, the number of clinics can be maximised? Because I think that was a real issue. And from personal anecdotes, I've heard that a lot of more sick people are now using the ferry rather than the plane. Thanks.
Yeah.
So I suppose the answer is yes, that is what we're looking at. And whatever the transport arrangements are, the NHS will say that they've, had to look at arranging clinics around that or patient travel around that if it's the patient that's coming to Stornoway or Inverness. And obviously a change to that means that they have to look at their clinics, which if they're part of a service level agreement with one of the other boards, makes it particularly challenging for them. So they do look at it, but yeah, could there be improvements? I'm sure there could. So just in terms of having it most effective, the time most effective, so that, or by clinic, so that more people could be taken in one day, if that's when the transport connectivity works. So we're looking at that, and I suppose that's when it comes down to data. It's understanding the volumes of who's moving where and for what need, and just matching them up is the process.
Feinioch on the barre, Kenneth.
Oh, sorry, there we go. Hi there. Just to continue what Councillor Steele was saying, both the Scottish and British governments have committed to providing healthcare at the point of service for free, and that is evidently not happening when you have to pay thousands of pounds to, give birth to a child. The other thing that might be useful, just for yourselves, in pushing forward with this, the British Medical Journal looked at 108 studies looking at the health outcomes, be it survival rates and time spent in hospital, versus time travelled to healthcare facilities. They looked at 108 studies and they found that 77% of them showed a negative impact on patients. So if the goal is to give the patient the best possible health outcome, then it's clear we shouldn't be forcing people on these long, arduous journeys that take 3-4 days to get to Stornoway and back, from Barra, versus a day to get to Benbecula or 2 days to get to Stornoway. That's all. Thank you.
Yeah.
Yeah, I agree, and it comes back to, yeah, health outcomes is where we should be looking at in the end. It's obviously very difficult to, you need to look at that at the macro level, and it's, you know, it's particularly with small island populations, it has to be years worth of data to understand if there is a positive or negative impact. But there are certainly, and we're aware of some studies as well that have highlighted that. I think there was one quite recently in terms of accessing cancer treatment in the Orkney Islands that showed similar outcomes to that you've highlighted. So if you can share those studies, that'd be most welcome.
Okay, that's fine. I'll email them to you.
Thank you.
Thank you, Chair. I apologise for coming back in. I'm not a member of the committee. The history behind patient travel, when I joined the health board some many years ago, all of the costs for patient travel were covered by the Scottish Government. They changed I think in the second year that I was on the health board, they changed that to giving a budget to the health board, and that immediately created problems, particularly with escorts, and that is where the problems started. From that point on, the problems started, and they continue to this day. I get regular stories through the cancer group of men being refused an escort, and I don't understand what the reasoning is behind it, really. I mean, if you're diagnosed with cancer, you're worried, so why shouldn't you have an escort? The other point I wanted to make just briefly is that this council is not funded to provide inter-island flights. We do it, and we did it a lot more in the past, but basically we're setting aside a chunk of our money from somewhere, I don't know where it comes from, to help with inter-island flights. I believe that the Scottish Government should pay and should give us some money for the inter-island flights, and then there wouldn't be an issue.
Well, I mean, going to the function and it was Maraha Isaac and see medic that she fain with no root or can chorus ficket bluma. I was see medic that so a real to saying, hey, you go suas. I was that a way Mara Hain, I was Campbellton. Er is mijn eigen werk ficht millen en echt dicht millen. So als je wel zo is, als je zegt is zo normaal, zo ga je mee dat je vrienden en gaarlijke mij giet van me. Ja.
No, I agree. I was just going to maybe come in about the reimbursement scheme. Obviously, it's the Highlands and Islands travel reimbursement scheme, and there is that commitment to look at. Certainly, I was just looking at the wording of the commitment. I think it's the guidance around that. So that's maybe something that the government acknowledges and is going to explore. But you're right, and it's interpreted differently by different health boards in terms of what they provide currently.
Steffa, I'm going to stay used.
This is the last time. It's just I forgot earlier on. We're talking about obviously patient transport and patient travels, and I think the conversation obviously overshadowed that. I forgot to mention that if we sort the transport, we have an excellent healthcare in the Western Isles, and our colleagues deliver a very good service in the Western Isles. So I wanted to mention that the patient that talked to me about her experience for maternity here, she said apart from the transport, delivering birth for her second child in the Western Isles was like being in a private hospital, and the excellent healthcare she received. So just to balance that, I wanted to mention that earlier on. So thank you.
Mustafa.
Yeah, and certainly the evidence that has been provided shows how lower the waiting times are in the Western Isles compared to other health boards. So it's borne out by that information, certainly. Yep.
Right, door kistig, Dennis a biela, and you make a gar line, and you. Oh, a Callum, mi cianal safach.
Romy Sal, when we could left Solis show, Harosu Quan. Just a quick, can I take you to the patient travel data? By the way, Neil, thank you very much for this. This is long awaited, and thank you. It's good to see such a report as this. It's actually enlightening us far more. If anything, it's late but excellent. So thank you very much for it. Patient travel data.
Yes.
There is 1,161 from the US to Stornoway on that year, 2023. Is that correct? I've got that.
Yeah, that's my understanding. So I think it's just patients. That doesn't include escorts.
That doesn't include escorts.
Yeah.
So you could have probably
a larger number.
So really, we're looking at about 20 a week, easily. 20 times 50, that's over 1,000. So you're at least 20 plus probably escorts. That shows you there's quite a lot of them. In other words, most of, say that most on these planes are for the health board. I'm just saying that goes again to what Councillor McCormack said earlier, is that the council are actually paying for this. The council are paid for it, not the health board, which is, to me and to many of us who have been discussing this should not be. This should come from either government or through the health board. But that's just a statement. The council are paying for this, and really they shouldn't be. We shouldn't have to pay in that sense. It should come because, as Mustafa was saying earlier, I'm shocked at some of the statements that were made today. Basic human rights, as we were saying, is not afforded to those in the US. It's a simple case. Some of the basic human rights aren't afforded to those in the north as well, because I'm going to just say another one thing you mentioned in your action plan is the access to healthcare. The access to healthcare, and it's already mentioned here, is dependable on connectivity. And really, our connectivity is not dependable. I'll give you an example of 1 or 2 patients that I've been talking to over the last year. Some patients are discharged from Raigmore or from Glasgow and are travelling there by ferry and back. They reach Inverness to be told the ferry isn't sailing, and the ferry isn't sailing the following day. Now, these people are coming sometimes with stomas, sometimes after having treatment for cancer. They're having to stay overnight in Inverness or somewhere after being discharged from hospital. Now, and then they can't get across. So one of the things that I've been on about before, and I must say I was pretty hard on high trans and the chair here, maybe some years ago. But I think that's something we should be looking at, the dependability of our connectivity, because it is not dependable. And the other thing is, and this is another, just an addition, when the patients do come to Stornoway, patients then are discharged, and where are they discharged? There's no means of getting off the ferry. They have to go through the cardiac. This is patients come just discharged from hospital, having to then, and to be honest with you, what I hear from these patients is that the workers, Calmark workers, are excellent, but still they have to go through this cardiac and have been done so for the last, how many, a year and a half or so. These things shouldn't be. So maybe we should add this to your lengthening list, Neil. But anyway, thank you very much.
Yeah.
No, thank you for those comments. I suppose just the first one in terms of who pays, rather than give an answer to that, we all do. So it's a matter of how do we do both the provision of health and the provision of transport most efficiently and effectively. Because I'm conscious of whenever it's raised with, the NHS board, and I have heard that argument before, I also hear them say, well, we're already stretched, and in terms of would anyone like to see a reduction in potentially healthcare services, and the answer is no. But I think by us all speaking together, we're already identifying ways that things could be done more efficiently than they perhaps are at present. And then the last one is I think the bit that you've highlighted that gets lost, and Cardeck, I was on it last night, and you're right, it's bits around that. One of the ones that was highlighted by the patient group was at Eriskay, if they're taken there, there's no toilet facilities. So could the taxi, rather than having to wait there for an hour with no facilities, ensure that the person actually waits at a warm accommodation en route, so that it's time to just be in with that to improve the experience for patients. So I think there's things around that can be done for zero cost that make it a lot more pleasant.
Yeah, thanks. The answer to that would be as well, of course, that the Comhairle are stretched. Services in the Comhairle have got to be limited as well if we the cost that's bearing, we've got to bear for that as well. So
100%.
Yeah.
Right, thing is to be early. Daniel? Okay, we doen nog close nog een snel. Maar een tank. Dat gedoe je shit veel maar. Tank voor gaan bullet dan zo'n een kisten kutjach. Ja. Wil je een kop thee? Ja. Als je keer staat zo'n 10 minuten. Ah. Oh, hier. Clever. Staat is in zo'n 10 minuten. Huige het boeien oproeg bouw of ik in Husky roten en jullie dan goorlijke klank voelten en je aankal. Hij weet een gelijke ik goorlijke gaag en bouw uur je heug naar oorlijken en weet en bouw agaal. Zo wel boeilijkundige maar dit kinnig en mag kleur de huige het boeien oproeg bouw of ik in Husky roten. Wel zo kundige. Ik heb veel meer gejoeld gewaardig bij u. Het is in het koers het kusper schech als klierige woelen, zo woon als constructor. En als ik zo als een visserige als een menige oosters in een leefleerne de pievige zijn door eindiger runnen, dan wil het kede dicht koken dicht er zo'n unet constructor genoeg is. Hij pechige en naast ik borst hamertig konjustig en jechens gij. Bini kalama konjustig en naast is fikti kisten same. Shane column.
Thank you, Chair. There's quite a lot of detail in the report in front of you. I'll just summarise some of it, then I'll just open up to questions. In terms of strategic risk under Section 6, there is a risk there remaining as high, and that's failure for the Comhairle to adapt to the effects of climate change. The effects of climate change, I think we're all seen some of them just now in terms of our coastline, in terms of our connectivity at times as well. And the main focus that appears to be coming from here just now is turning more to adaptation. There has been a real focus on the use of energy, net zero, but I think equally important is the impact of how we adapt to climate change, especially on our environment. And there's a lot more work to be done on this just now. There's various groups been formed nationally looking at climate change adaptation and what that means for communities. And that'll come to yourselves as a committee during the course of next year when we start getting a bit more detail on that. In terms of the rest of the report, there's a lot of information there in Section 7 about the various outcomes that we're looking at, we're working on throughout the department. If I just maybe generalise a statement, and that is that our infrastructure is in need of investment. There are various competing priorities coming to us. We're having less resources to deal with more investment needs. And I think going forward, it's going to be a real challenge for us in the Comhairle to prioritise what we need to do. So again, there'll be a report coming to you yourselves, possibly through this committee, but other committees as well, on what investment priorities that we're currently dealing with and what we need to focus on as well. In terms of budget, I think I don't need to say to you that we have some challenges coming towards us over the next year. Our own section in terms of finance are having to look to £1 million of savings. Now, that's looking across roads, buildings, waste, all of these services that are frontline services. So, I mean, we have that we have the challenges the same as any other department to meet these budget savings as well. So there's going to be some probably difficult decisions to be made over coming months. Chair, I'm happy to just open up to questions.
Eistig dyn sy bi. Yn tri aws y dosiach.
Thanks for the report, Carla. You mentioned digital investment, whatever. Things are a bit iffy yet in my areas. And is there any chance we could get somebody in to give us an update where we are from Openreach or whoever? I remember a couple of years ago we had somebody in and they were going to follow it up. So
I'm happy to do that.
Yeah.
This is one of the elements that Eilean was dealing with before he left.
Yeah.
I'm picking up where he left off on that, but certainly we did get some information through by presentation form. Mona Mackay's been attending some of these presentations as well, so I'll get more of an update for you and maybe come and speak to you specifically about the areas that you're talking about.
Yeah, okay, thank you.
Carol, I'm just going to come in on my Councillor Ian's comments there about connectivity. R100 delivery team or non-delivery team, more like. I mean, we've been on at them for a long time now and lobbying them to deliver to the most needed areas in the Western Isles where there is no connectivity, and we've been totally ignored. And I think we do need to chase them up and get them into this chamber and challenge them on the lack of delivery for R100. I mean, we are not a priority at the moment, it appears, so we have to remind them that we must be a priority. Thank you.
Happy to do that. That's okay.
Ramit.
Thanks, Chair. I'm not a member of your committee. Following on what Councillor Craig said about connectivity, I think as part of the same department, Donald chairs sustainable development and vice chair sustainable development. We've been on about connectivity and its importance in keeping us, sustainable. Never mind growing. And now we're talking about the digital connectivity side of things as far as Openreach is concerned. They fobbed us off the last time with why it can't be done, and it's pretty obvious that they're not willing to invest in the cost it would take to do it. Like a basic human right we were talking about earlier on with healthcare, which is very obvious and fundamental. You can include things like internet accessibility now and phone services as almost a human right, and the failure to deliver on that when every other service is available in probably every house in the Western Isles. It's ridiculous in this day and age that it can't be delivered at a reasonable cost. But again, when we were talking about the cuts that we're looking to be making with the budget restrictions we're going to have over the next couple of months, the unintended consequences of what we might do when we're looking at what it is we're going to try and save money on. We need to be very mindful of the fact that we're trying to create connectivity ourselves, never mind with governmental help, to make connectivity within the islands much better so that we can attract inward investment, not just in terms of people, but in terms of businesses as well. So I know you've got a hard job ahead of you, Calla, because everybody's been asked to try and save some money because we've got to find this £4.5 million between now and next February. So I think we need to be very careful, and I'm sure you'd be mindful of that, Calla, that, you know, the unintended consequences of what we might not fund and might not be able to fund through no fault of anybody's really, particularly with, I say, roads. Immeasurably, roads are going to be an issue, and the maintenance of our roads is bad enough. I mean, I don't know. There was a figure a couple of years ago on what it would cost us to get the roads back up to the standard they were at. I don't know what that figure is today, but it was something in the region of 40-50 million, probably more than that now, to, you know, just to get back to parity with what it would have been if we'd have kept up. And a roads investment, what was it in 2008, Calla? Can you remember?
You were looking at 42 million. I would say with the way costs are going now, you're probably nearly doubling that with cost of tire construction and energy costs relating to that. So
and the roads budget is?
The roads budget is.
Revenue, yeah.
The roads, well, it depends how you look at it, but really the amount of money.
Under 2 million.
No, the amount of money we have in revenue to look after the roads, to actually put out and do stuff, is probably around about 1.2, 1.3 million. There is capital on top of that, which we got an extra injection of £1.3 million from the Comhairle last year, which is going towards
standing still.
That's what we're doing. We're standing still.
Yeah, like I say, I mean, we're talking about connectivity and trying to develop connectivity, and we're basically firefighting to stand still.
Nuash, Mustafa yeast.
See, what's wrong? You're picking on me this morning. Thanks, Calla. It was just, I think, at least from what Councillor MacDonald was talking about, you know, obviously connectivity, but also talking about schools and youth facilities. Obviously, we just talked about health improvement and how important that role can be for attracting and maintaining the population of the Western Isles. But, you know, the youth population is very important and can be a huge factor for somebody moving up or staying here. So education facilities, I know we have a challenge, obviously looking at the new facilities in Barra, but also you're looking at your report that the last one who did this Scottish tour, and there is got the school estate now is getting in a difficult situation. We talked yesterday about play parks, you know, youth facilities, connectivity, all those things. I know you have a challenging things ahead of you, but ahead of us in general. But yeah, just so in prioritizing, if we could also look at, you know, the importance of keeping and improving youth facilities, you know, so thank you.
You're right, Mustafa. There are so many competing priorities that we're going to have to consider. And as Councillor MacDonald was saying as well, there are consequences of what we do as officers, as members, decisions that are to be made in the future. But again, it's going into that with an open knowledge of what the consequences could be.
Okay, yeah, news it is the next dosher news illa. News, come så så att det news sånt kan jag stay. News.
Thank you very much. I'm not a member of your committee. One of the things that I was considering in my mind when I was thinking about the future, I mean, the situation is pretty dreadful, but you're going to be involved in huge, you know, construction projects and so on and so forth. So are you not going to need more engineers, for example, or more staff of one kind or another than you currently have? And how will you do that if you do?
It's a considerable challenge, Councillor McCormack. What I will do is I'll take to a future committee the list of physical works that we're involved in this now. And one of the challenges we have, the way that our budgets are allocated and assigned, that the first bit of work you do to any project is the pre-construction work, which is the conceptual design options and the design itself. Then you go to procurement, and we have so many projects at that stage just now that that's not where the big money's getting spent. But it's got a huge resource demand on the kind of skills that you're talking about, and that kind of skill that you're talking about is getting scarcer to find because there's not many people coming through. There's also going to be a huge demand on that kind of skill when the major developments start kicking off in earnest here in the Western Isles. So it is a huge concern that we have. The next stage of all these projects, of course, is construction. And the way we're actually phasing this is lots and lots of design, lots and lots of procurement, and then a lot of construction coming at the same time. So these are lots of challenges for us. So I can go into more detail at another committee to show you where Stornoway Primary Sports Facility sits. Castle Bay, additional support needs. Nicholson, additional support needs. Reallocation of accommodation for Blairboya residents. These are priorities that are coming at us constantly. And I appreciate that you appreciate the difficulties that we're going to have, but I don't have a quick answer for that because the resources are hard to get. We have a team that are inundated with work just now. I would love dearly to have more resources there, but really looking at the future as well, balancing that, and then taking in resources or consultants through frameworks as required is what we're doing just now. So that's how we're managing that resource requirement.
Right, America News is there, you know, say ahead of feel pillar.
Thank you, Chair. My question is probably more to Mr. MacLeod than it is to Mr. Mackenzie, because I want to take advantage since the last meeting here. It's more budgetary pressure, I'm afraid, to do with the Crossbus Cemetery extension. I know I've been asking about this even since the last term, but I know it's not on this agenda, but I think it is a budgetary item and it is going to be a pressure. As you know, the existing cemetery is getting very near full capacity, and increasing demand will come on us to extend that cemetery in the very near future. So it should an update, Mr. MacLeod, before you go, of where we are with this and if it's passed on and somebody could pick up on it. And my other question was going to be, again, Mr. MacLeod, probably at 7.17. How much did we actually save from the 3-weekly collection of bins?
Solution Moloch, show. Could you guess? Give me a ashes to you.
Thank you, Chair. In terms of Crossbus Cemetery, my understanding is that we're still involved in the acquisition of the land. I don't have an update at the moment, but I know that that's being very, very slow. You know, that's been the big hold up. There is some capital funding in the capital programme allocated to cemetery extensions for the current capital programme, and the priority in terms of actual work is being looked at. There's a wee bit of work being done to look at Comhairle and Bernary in use, but the Crossbus is on that list as well. I can certainly leave instructions to my colleagues to provide you with an update where we are with the procurement of the land, because that's the major issue with Crossbus. On the 3-weekly collection, the expectations were to have or the estimation was about a 50k savings on the 3-weekly. We have achieved that on landfill tax, but I don't know what the overall net off figure is for, because obviously we've had half a financial year and we don't actually have access to the full financial information that we would normally have, yet it's still unavailable to us.
Thank you for that. I'd appreciate if you could come back to both myself and my colleague, Councillor Mackenzie, on Crossbow Cemetery, because my understanding is there's less than 5 years at the current death rate left in the existing cemetery. And if we need a 5-year settlement period for a new cemetery, we could end up in a bit of bother.
I call them the gaze to you, so okay, yeah. Right, the end. Oh. A mis an varach a legal estate dosje geen
Tapel do you thank you again for letting me in. Looking forward to looking back to we're all aware of the condition of St Brendan's and Castleby School. You listed in your report there's investment requirements in St Brendan's, and we also are aware of the condition of Castleby School and the pre-winter maintenance and the additional sports needs. What has been done and what have you got planned for both the school and for St Brendan's?
Come solo secretarian. No, could you get solo?
So let me do it.
Okay, with St Brendan's, I mean, you're aware with both of these facilities that there are.
Yeah.
The campus would have been the
Yeah.
solution. What we're having to look at just now with Castleby School is facilitating additional support needs pupils coming in next August. And so the adaptation's been made to the primary section and a lift for the secondary section to make it more accessible. We're also keenly keeping an eye on what the heating system is functioning like in Castleby School, and again with the roof, having some regular checks on the roof fabric as well, and undertaking some minor repairs on that. Obviously you can't do anything major to the roof without significant works, but we're managing to keep on top of things just now. St Brendan's Hospital, we've just set up an oversight team and a project team to look at what are the short-term requirements there. There's a requirement to look at the heating system, predominantly at St Brendan's. Again, there are going to be restrictions on what we can physically do. You're dealing with a hospital A&E section and with a residential home, which it's not easy to do physical works in. And if you were to do work in existing heating, what do you replace it with? And what's the impact on the residents? So the first step in that is to better understand what the limitations are technically and operationally, and then to move that to some options. So with St Brendan's, it's mainly looking at the heating and electrical system, and with Castleby School, it's basically keeping an eye on the heating system and on the roof fabric. And there is that works to facilitate the ASN pupil, and that's been funded, it's been designed. We're looking at taking that to procurement very shortly.
Thank you for that, Keller. Realistically, how long can we carry on like this? You know, it's obviously an impossible job for you as well, and must be heartbreaking spending money that's, you know, that isn't going to achieve anything at the end of the day. You know, are we going to have the same problem next year again? Because
we as I said earlier on, we're increasingly dealing with a deteriorating estate, road network, and we've talked about facilities for youth. We've talked about investment in connectivity. We're going to have to manage that situation. As far as Castleby School goes just now, if we can keep on top of the roof fabric with the remedial repairs, there's always an eye to, yes, the final solution. It's just over a hill.
Yeah.
How far that hill is, I can't answer that just now. But
no.
From our own perspective, we're working closely with Dan Macphail as to what the options are emerging to be. Is there ways that we can actually do something with the money we have allocated just now? What's the best we can have done with it? So I'm working very closely with Dan on what the emerging issues are and what the options for investment are as well.
Yeah, I appreciate it's more or less impossible position you're in, and you're doing the best you can under very conditions. I've got one more question.
Yes, come on.
Is there something that we can do about these red light situation at the moment? Because our old system used to be much more accommodating for passing places and weeding and things. It's
I mean, you know, do like that.
okay.
Lutisha.
Well,
Callum, will it do you know that when it's all?
I'm playing freakers or something.
In terms of priorities, it's not the biggest of my priorities to sort, and the chair is doing a fantastic job at keeping everybody audible and accessible.
Could you, next year?
Right, okay. En ga je mythologische freakers als iets.
Say no, I'm just political we can't read now.
And you listen, Chair, thank you. Can we go back to the roads maintenance programme? And can you give an indication of what stage we're at in terms of the programme? Are you satisfied that we've reached, is it near a conclusion in terms of repairs needed? And you mentioned earlier about there is a mixture of capital and revenue for that budget. Would just using the capital suffice to meet the requirements of that programme?
No, it depends what the Comhairle's aspirations are. I think our department's aspirations would be to try to get to the stage where there is less of a percentage of our road network needing maintenance. But again, we have to balance that against what other facilities need money spent on it. So as we're just having the conversation with Councillor McNeill there, we are having to do the best we can with the resource that we have.
Yeah.
If there is additional money, then we will use that the best way we can. There's also geographical things that we need to take into account.
What's the capital? What capital is involved in the programme at the moment?
The capital programme.
I think you mentioned 1.2 for the revenue, didn't you?
Yes, there was 1.3 additional given. There was 2.5 million to roads over this. I'll have to come back to you on that one. I think it was 2.5 million to roads. It was 3 million to property. I can clarify these to you, but we did take a report showing the annual spend on various elements of capital. So it's not just tar that the roads capital goes to. There's bridge maintenance, there's cattle grids, there's street lights. You know, there is a huge inventory that we're trying to maintain with that money.
So 1.3 revenue and over 2 to 3 million capital.
Yes, over the 5 year.
Yeah, for the programme.
Yes.
Thank you for the moment, Chair.
One thing I am doing is we're working on making, instead of giving you a spreadsheet of where we're working on, is actually giving you a map of what we're doing just now and what we're going to be looking at doing next year. So that actually highlights the areas of roads that have been identified for maintenance. That doesn't go to say that if there are roads that can be repaired, that's the first place we'll go with pothole repairs. And we've invested in road mending equipment that's been quite successful up here now. So you'll see that we'll sometimes do a temporary repair on a pothole and it'll be out, especially in the winter. We might be there a month later, maybe even a couple of weeks later, depending on the conditions. But when we can get the road mender onto these, it seals it nicely. So we are working with other types of equipment to make the repairs a bit better.
Be meet down here and
So I'm not proposing this, but would it be a significant risk if we suspended the use of the revenue and just used the capital on this programme for a short period of time? Does that make sense at all? I'm just
Not at all. We are so dependent on revenue for our repair work, and I mean, you're making a proposal. I could put.
No, I'm not. I'm not going to get blamed for.
Okay. I could give you the implications of that at some other time, and I think that will probably come through the budget setting process anyway. That the impact of taking that out.
Right. Yeah.
But you know, one of the other implications are that there are income budgets there as well that we're not meeting, and the income budgets were actually when we had more capital. Our teams were working on capital related jobs, and that was then going into the revenue pot. That doesn't happen anymore. So there's these things we need to bear in mind. But
why doesn't that happen anymore? Why can't that happen?
Because there's not enough capital at the levels we used to have. But again, I think this will come through the budget setting process where I will be asked these difficult questions. What's the implication of you not having a revenue budget?
Can you produce that kind of?
I certainly will. Yes.
You will survive.
Thanks again for letting me in, Chair. I'm not a member of your committee. I don't know what red lights Ian Archie was mentioning there. We had red lights on the road to Point and nothing happened for a month, so I share his frustrations. Going back to Cala and the major developments that are going to be coming onto the island, particularly North Lewis, over the next couple of months, in conjunction with the works that are already in the pipeline, which your department are working hard to produce documents for, which there will be a tendering process, obviously. I worry that going forward, it's going to be more and more difficult, and this may very well affect Euston Barra when projects are coming up there, that there's going to be so much work around, so much possibly easier work like pouring concrete, etc., on the go, that we won't have enough of a workforce locally to actually tender for some of they can pick and choose the work that they're wanting to do. So we may end up in a situation just now where we're putting tendering out to these contractors to do the work that we need done, but they are going to cherry pick from the major contractors that we've got. And the danger is that we may end up in a situation where they'll just look and say, well, I don't fancy that, I'll do this instead, I'll tender for this. Do you envisage a situation where that could be very well be the scenario?
Comhairle. Yes. What we are doing is there's the major development oversight board that's been formed within the council. The first meeting of that took place, I think it was last month. So we're in the process just now of highlighting all the potential implications, and that's certainly one of them. And it may be that we do suspend some of the planned works that we had because of the lack of availability of local contracting force. But there's going to be lots of other implications needing to be thought through, not least accommodation, the impact on our roads infrastructure with heavy haulage, with the amount of workers coming here, the healthcare services that we were discussing earlier on, will there be a bigger demand on them, and on our transportation and connectivity links. So there are going to be major implications, and these we hope to be bringing to the major oversights board here, but also linking into national government as to what these are and how we can regionally or nationally help that situation.
Yeah, I mean, I think we've already identified the potential risks. if we don't get investment, we're talking about, I don't know, £2 billion worth of spend here for a project that's going to affect the national energy infrastructure and feed into it. And it's of crucial importance, I think, to the British energy security that, we have production, more of our own local production from the UK going into the grid. So the importance of the project isn't lost, but the resources within the Comhairle, which are diminishing year by year, to deal with these major tasks, particularly with regard to planning, as we're all aware, and the impact on roads, infrastructure, etc. We are petitioning government, I'm pretty sure, hard for more support to deal with that, but we're facing, I think, a logistical, I wouldn't say nightmare. We're all looking for more work, and it's going to be good for the folk who are involved and who are producing the services to provide infrastructure for these major companies. But something may fall by the wayside, and it could be the smaller projects that that we're relying on to get done. So I think maybe we need to kind of stagger or triage some of it to work best for us, because the local folk are going to see big companies putting turbines here and turbines offshore and roads and a lot of movement, a lot of people coming to the island, the substation network in Arnish getting busy, etc. And they're wondering, at the end of the day, we don't work in isolation from the local community. We have to make sure that they feel part of this. And we've talked before, there's another committee for substantial community benefit and a legacy at the end of it. But working our way through it is going to be like walking through treacle, I'm afraid.
Well, I agree with what Councillor MacDonald is saying. We need to very carefully work our way through this. Bearing in mind, this isn't just a Western Isles or a Hebrides issue. This is happening across the whole of the north of Scotland. Aberdeen are already feeling some of the pain of this investment. I'm calling it pain because what they're finding just now is they're starting to get these early indications that resources are being taken from local authority into the private sector. So the likes of planning resources in Aberdeen have been going to the private sector just now, to these major developers. So they're starting to see this happen just now. And if you look at the picture across the whole of the north of Scotland and all this taking part at the same time, it's a national, it's a regional issue, and we're going to feel it acutely here in the Western Isles as a local issue. And I think that's why there's been there is this engagement with national government, the Scottish government, and we've put some information together at a local perspective as to what the picture looks like with potential implications. We've built up a regional picture using the Scottish Futures Trust and had that discussion with the Permanent Secretary. So that's happened. And so there's that first link into, right, and this is the impacts. And they're now starting to ask, okay, what do you need? How can we help? And then it's about moving through that. But I think that there is going to have to be quite a focus from government on what's happening in our regions, and for ourselves, for the Outer Hebrides, and understanding what the impacts are and what help we do need. Because it's very easy to say, these are the impacts, these are the implications, but then to find out, okay, what do we actually need to get through that? If that helps.
Right, thanks for bringing me back in, Chair. Just a couple of points, questions from Mackenzie on roads. I noticed as a frequent traveller through Skye to Inverness that Bear Scotland are doing a lot of resurfacing work for Highland Council in the last probably year. And following on Councillor Crichton's point about capital, do we know if Highland Council have released capital for this works? Because they seem to have, I know they're under, every council's under the same revenue pressure, but I just don't know where they got all this money from all of a sudden for road repair. It's huge. And I think the Chair himself's probably seen it in the last few weeks too, travelling. The roads are much improved. That's my first point. That's my second one too, is on the roads. Do you know how much we're actually giving out to third-party contractors for our own road repair, simple road repairs like pothole filling, compared to what we're doing by our own staff? is that eating into quite a bit of the budget that we have? And could that be done differently? Could we do more with our own staff than put out to third party?
Comhairle secretary next.
Okay, for first question, the main road through Skye is actually a trunk road, which is maintained by Transport Scotland and not Highland Council. We don't have any trunk roads in the Western Isles. But I do know that Highland Council, as part of their investment planning, have looked at raising council tax in order to invest in their infrastructure. So they've taken that decision. I've got a copy of a report that Highland Council considered on this, and happy to share with you. It's a public report, but it goes into the detail of how they secured additional money through the Highland Council for investment in their infrastructure. I'll share that with you.
Yeah, it'd be good to see that.
In terms of how we deal with road repairs, we do use third-party operatives. We've had them trained up, and we found it a good way of getting the repairs done consistently. We could take that in-house, but they would be again a cost to ourselves. It's something we can look at, but what we do find is that our own team is quite small, and moving on to seasonal work, it's quite difficult to actually manage the whole workload, and that's why we use contractors, that we pull them in when there's peaks of work. So our staff just now over the last week would have been fully occupied on gritting, and they will not have been able to go out to do any repairs to roads or do any ditching or any other repairs that are required. So that's why we have that balance of a contractor who we can call off when we need them, rather than our own staff not being able to get to things. So it's a balance we've found over the years that works. If we were to do it in-house, it would mean that you've got that resource all the time, whether you need them or not. But again,
at a cost, obviously, Mr. Mackenzie.
Yes.
And given the budget pressures we have, it would be good to know what the cost implications are. You know, what are we actually given to third party? I know we couldn't do road repairs. You wouldn't do road repairs with frosty weather anyway, because of for obvious reasons. So it's just to make sure we've got the right. How many staff do we have in the department on roads, between gritting and between?
Okay, we've got 3 in Uist, we've got 3 in Harris, and we've got 6 in Lewis.
12 in total. It'd be good to know the comparisons of the figure of, you know.
Well, I mean, I'm really open to having these discussions with yourselves, whether we do it at a MAUG, where we can get a bit of detail and a bit of discussion around them. But even through the budget setting process, you know, any of you members can come and speak to me about, okay, what about this? Have you thought of that? And then just giving I can give you a bit more information on how each of the services works, whether it's roads or whether it's property maintenance or any other services at all, because I think it's really important that, one, we are challenged on how things are being done, and 2, that they should have better understanding of what maybe some reasoning why we do things the way we do just now.
Just looking at best value, obviously, for what we have.
Staffa.
Thank you. Just referring to, I think Neil said in the past, in the previous presentation, that there's no toilet facility in Eriskay and having to take patient. Is there any problem with the toilet? As far as I know, there's toilets and shower room and the waiting room there. So
I did give him a wee nudge, and he thought well, maybe it wasn't Eriskay he was talking, so he's going to go and find out what.
All right, okay, because I wasn't sure what it is. And I think just a quick question to David, not to be left out in your own snake. You mentioned about the Kilmuir Cemetery in Bernery. Last time I think we spoke, you were waiting for the archaeology report and things. Can you tell us where we are at the moment with Kilmuir? And
yeah, we are still waiting for the archaeology report. We were given a good price, but not a firm date. So we're still waiting for that to be completed.
Okay, thank you.
Comhairle secretary.
Tapla, Chairman. Can I just ask at outcome 412, it says there, Cara, reduction in our carbon footprint and development of an island route map to net zero. Do we have an island route map to net zero? That's the first thing, and a costed one. Have we got costs? I think I've asked this, that net zero, this development towards net zero is going to cost the islands. Maybe I've got it all wrong and it's going to save us an awful lot of money. But have we got a route map, first of all?
No,
No.
we don't have a route map.
So therefore we don't have costs at the moment.
We have a strategy.
Yeah.
And that strategy was aligning with the government targets. It will need revised. Government targets on net zero have changed as well. And as I was saying earlier on, climate change has two components. It's got the reduction of carbon utilization, so the net zero agenda. So there's route map to net zero, and then it has the energy efficiency plans for communities and all commercial activity. So that's one element of it. There's also the impacts of climate change and how we need to adapt to them. So that's what you call adaptation. So without going round in circles, we don't have the route map to net zero as a council. We don't fully understand the costs of what it would take to get to net zero. And I think that's what would need to be developed over coming years, but balanced with our need to look at what's the cost of adapting to the impacts.
Absolutely.
So that's going to be a challenge over coming years.
Yeah, exactly. The one that I'd like to is 719. Maybe David here can be, and this is to do with the RCV, the refuse collection vehicle, an electric one. You've had it for a wee while. I don't know how long. It's been out in the garage when I see it out there, but no doubt you've done a fair bit of driving on it and whatever. What is your assessment on it, David? And you can be honest, because if you're finishing here on Friday, you know you can be honest.
Yeah, well, I'm happy to give you the impressions that we've got from the drivers on the limited amount of use that it's had. Unfortunately, there is no issue with the electric chassis, the platform. That's all perfectly acceptable. We've had issues with the software that works the loaders on the body of the vehicle. So it came as a package, but obviously the chassis, as most bin lorries, the chassis is made by one company and the bodies are made by another, and the company that makes the body assembles everything. But unfortunately, we've had issues with the body, so it's limited the use of it, and it's been extremely disappointing. The big problem that we have is that the supplier has gone bust, so we are really toiling to try and get a long-term solution. We have got various solutions that we can go down, but at the moment we're still fighting with the software, both for that one and a diesel version of it, which is equally as non-productive. There is another local authority in Scotland that has 14 or 15 of these vehicles and has the same fault. So we are working with them to see if we can jointly come up with a solution that works. But it is a bit, well, it's extremely disappointing. Thankfully, it was fully funded, but it's really disappointing that we've got new technology. We've got a platform that can run on battery, ideally for use in the town. That was the intention for it to be used, and it's not the electric bit. Although you could argue that the software is electric, but it's not the actual platform that's the problem. It's the basic body. It's the loaders at the end of the body that are the issue, and we're working quite hard with the company has bought the factory, but they haven't taken any of the liabilities in terms of warranty. But because they have staff that were trained by that company. We are working with them to see if we can get a resolution. We think we may have solved the diesel one. We're just waiting to make sure it's proven before we put the other one out for getting fixed. So
Right.
that's basically it.
Can I just ask on the range? Have you tested the range? How many miles can you get out of a charge?
We can do well. It's not really about miles for bin lorries because they're stop start anyhow. You know, your average.
That's right.
Your average bin lorry
Absolutely.
gets about
10 miles
to the gallon.
to the charge.
No, do more than 10 miles. It'll do a Stornoway route, or it'll do out as far as Tongue on a day on a daily charge.
Yeah, that's about 15.
Well, it's all stop start. I mean,
Yeah.
you know that's
Being honest.
it's all stop start. You know,
Yeah,
it's not
absolutely. Absolutely.
You'll probably find that your bin lorry with a diesel engine on that route is probably getting about 5 to the gallon. So you know,
5 to the gallon. I just anyway, I'll leave it.
Hashtag Dennis Biela. Anil. Haramet. Eisem Colton, of Allah, we gedech undige kutikinenes da ja Open Ridge son. Van een hometiako. We zo kun je zijn een giste weg. Ai. Ja. Ai.
Goed het torach het reinet morgen. Agus mis men geen kinje sin had duurlijk jaren. Adin van eind. Kan je duurlijk kan je mis men geen kaal na morgen jaren. Beter prima jenach. Ha mis men geen kwal ganar hi % rakel as a rioch haast. Agus ha koskis go vi choars had het fasker. Agus ha de gien kun gat mein packages on canoch broadband steken en hei. Zat tot geef het is zo'n janu ach. Hoe je uit dan canoch? Ja aan. So good is in fijn in jaar gaan.
Okay.
Gewoon als je dat open uitchach. Ik had de sterkste Josje Nieski ook.
Ja, mag mee gestikt in je cv. Hij gaat het niet vaker. För vi lu gick komma till över pöjle kundige en askast van jaar. Nou, ja. Kuspere hoog, visserige maar hele vissen reinig skuttel. En askast is dan visserige agus a torst visserige moe. Rau ílech na Comhairle skuttel agus bli ní daimhe mar cleud is an ask agus victi kirsten sa me.
Thank you, Chair. This report provides an update on the Comhairle's waste strategy. The Comhairle's waste strategy was approved in 2012, and although that's a fair number of years, it was designed to meet the requirements of the Waste Scotland Regulations 2012, which is still the primary driver for waste regulations in Scotland. Although there have been quite a few new developments, it still feeds back to that. The strategy identified 11 actions in section 6 of the report. You can see the 11 actions. 9 have been completed. The other 2 are marked as amber, and we expect these 2 actions to be completed in the 2026. The first one of these is greater responsibility for packaging manufacturers. That's come in as a UK regulation under the Extended Producer Responsibility implemented by DEFRA. We will receive notification, it was supposed to be in November, but it probably going into December, of an estimate of how much additional income that we will receive for next financial year, and that money will come in to the Comhairle in October 2025. The expectation at the moment is that that will be additional funding at least for year 1, but not really sure what happens after that. Mentioned previously already today, the 3 weekly collection service for waste and recycling in Lewis and Harris allowed curbside recycling services to be provided to the remainder of the households in the Western Isles that didn't have that service. It's resulted in an increased recycling rate from 31.8 the previous year to 35.1. The Comhairle remains the best performing of the island authorities by a significant margin, and we're now very, very close to the next group of mainland authorities. If you look at the graph on figure 1, which is in section 7, you can see where we sit in relation to the other local authorities. Had we just jumped up by about less than 1%, we would have been significantly higher along the group. At the moment, it looks as though we're the 4th worst, but we're pretty much in that group that would take us into the sort of bottom quarter of the local authorities, and not that far off the middle group. If you look at the ones beside us, mainland authorities such as Highland, Western Bartonshire, Dundee City, and even City of Edinburgh, not that much higher than us. So I think we're doing reasonably well, and the rollout of 3 weekly has definitely improved recycling and reduced landfill costs alongside that. It's the one thing that we do know, our landfill tax last year was down by roughly about £100,000, but there are obviously costs in running these additional services. The regulation on biodegradable municipal waste to landfill, that comes in on January 2026, and that basically means that we'll have to send all of our refuse collections and some of our bulky waste to the mainland for energy from waste. We have had confirmation from CalMac that there is sufficient deck space available to us to do that. That was a bit of a stumbling block up until now, but we managed to get confirmation of that about a month ago. So we're now in discussion with SEPA and Scottish Government to see if we can get funding for a waste transfer building that would allow us to take that material, load up lorries and get it away for energy from waste treatment. Hopefully we can make some progress on that. There are likely to be, there's a report carried out by SLR, and there are likely to be increased costs associated with that. So I think there is a need for making sure that it is compliant with Island Community Impact Assessment, albeit that the legislation predates that. The implementation of the legislation would suggest to me that there is an argument to be made for additional funding. So moving on, deposit return scheme, that will return in 2027. The intention from UK government is to have a scheme that covers Scotland, England, Wales and Northern Ireland on the same basis. I heard yesterday that Wales have withdrawn from this scheme because they want to include glass. But those of you who remember the reports on DRS previously, glass was the reason why the plug was pulled on the DRS Scotland scheme, because UK government determined that that wasn't acceptable for markets across the UK. So I've been to see how that progresses. Bit of bad news on landfill tax. HMRC announced a 21.6% increase, and that applies from the 1st of April next year. Revenue Scotland and Scottish Government haven't confirmed yet, but they've always followed HMRC, and every indication I've had so far trying to find a definitive answer on that suggests that they will do so in this case as well. That will increase the burden on the Comhairle in terms of landfill tax on waste arisings from April next year. Not really a positive thing, but it will narrow the gap between disposal to energy from waste compared to landfill disposal. As I say, not necessarily a net positive, but that's where we are. In terms of the waste, biodegradable municipal waste collecting use in Barra, we are just a bit hoping to have a unit installed and commissioned in January that will pre-treat the waste. This will break down the biodegradable content. It will give us an option to go to landfill, but it's a cheaper option for us to look at shipping that out because it's been pre-treated. There's a lower gate fee, and we'll reduce the weight and volume by, well, the manufacturers claim 50%, but realistically, it'll reduce it significantly. So there'll be less movements on the ferries, and any lorries will be going out on the Lochmaddy to Uig ferry. So taking loading off, taking a larger loading off the Sound of Harris ferry, and a smaller new loading on the Lochmaddy to Uig. In amongst the bulky waste, we've got I'm sure you're all familiar with the awful acronyms, but WODS, waste upholstered domestic seating, which contain POPs, which is persistent organic pollutants. We're already having to take that type of material out of the bulky waste and send it for incineration, and that's increased the burden by about 18k per annum. But that's stuff that quite often contains wood sections, so a bit less to worry about in terms of the onus of the ban. So the final one is there's a circular economy bill. It's been our Circular Economy Act. It's been approved. There is a bit of work done on a route map, which will drive the next set of legislative challenges in terms of waste and recycling for local authorities. I have lobbied extremely hard and been involved as the island rep. I hope that in future that still continue to accept that there is a need for different legislation for or different interpretation of the regulation and guidance for the islands, and probably financial support as well. But they have included, for example, with extended producer responsibility, that they have generated a category for islands that's specific, and hopefully that means we'll get a bit more money out of that, and it's just raising the profile that we need specific support, and not just treated like a central local authority who usually save costs on all of these activities. The expectation is that the code of practice associated with the new roadmap will be statutory rather than voluntary as it is at the moment, but that's still to be confirmed, and no word yet as to when it will come in. Happy to take any questions.
Ronald, case ticket.
Thank you. Thank you, Chairman. Just on the requirement for the transportation of biodegradable municipal waste to the mainland, it's been imposed on us, and it obviously they haven't considered the impact for island authorities at all, and there is no guarantee. We have no guarantee of funding to support us to do this. As far as from what I can make out from your own comments, David, we're seeking funding, but there's no guarantee. So that's going to have a huge impact on our budgets. And in terms, there's been no island impact assessment, and they're saying because it was pre the legislation, but we know for a fact that there can be retrospective island impact assessments carried. I think we should be lobbying at the highest levels to get an exemption from this regulation, and I think we should do that urgently.
Yeah, I think one of the things to take into account if you are looking for that route as a means of dealing with it, that will probably be something that would be useful short term. But as we can see with the £20 per tonne increase in landfill tax, there is definitely a driver to make landfill, to basically price landfill out of existence for this kind of waste. And I think what we will need to do is look to see how efficient we can make the transfer of waste, as efficient as possible. Where we have the differential between the solution that we're looking at for used and barrel waste, is my expectation is that will be cost neutral. where we have Lewis and Harriswick, we have significantly more tonnage, and we have much less organic material in the waste stream to break down to generate savings from another process. So we'll view the equipment that's been put into market stands with interest to see what the real numbers are with waste going through, and see whether that's something that we can actually use. But I think basing a strategy just on a derogation and allowing us to continue to have to go to landfill is not necessarily long term the most financially attractive solution either. You know, it would have been, you know, a number of years ago, but it's not now, because the cost of a new cell, the cost of the next cell is probably going to be about £3.5 million, and at current rates it would probably only last maybe 4 or 5 years. If we remove the biodegradable content, it'll last 10, 12 years. So it is a difficult balance, but none of them are good.
No matter how efficient we try to be, it's still an additional cost to this council and to our budget. So we really need to lobby government on this and get an impact assessment carried out, which will make very clear, I think, that it's going to have a negative impact.
Yeah, I think possibly what we should be looking for is financial assistance rather than a derogation. But
our stuff.
Yes, I think. Thank you, Chair. I think Mr. MacLeod just said, has given my answer on that. It's financial assistance we need to compensate for these disproportionate effects. But since it's his last meeting, I would like to commend David's tireless work on this issue, particularly on the lobbying he has done on our behalf. I know his voice is heard. It doesn't always manifest itself in policy results. Of course, none of ours do. But there's no one who's worked more tirelessly on behalf of the islands, and not just the Western Isles, on this issue than David. And I would just want to commend him for that work, particularly on this item. Thank you, Chair.
Yes, that. Mustafa.
Okay. Thanks very much. Just a clarification for David. You know, like with the plant in market stand, that's obviously with the biodegradable. You know, when you break it down and you have the SRF, so is there anything else left, or is it completely?
No, the one advantage of this plant over previous attempts to do something with residual waste is that it doesn't produce a product in any kind. It's not trying to meet animal byproducts regulations in terms of time or temperature and treatment. It's purely to break down the biodegradable content. So you end up with a drier, lighter, less dense material, and that's why it attracts a better gate fee at the other end. But it also means that you're transporting less volume. We've also, with discussions with the suppliers, designed the process systems so that it's no real difference to the staff at market stands. They'll effectively be loading it into a hopper, and it will be discharged straight into a trailer via compactor unit. So it won't increase any requirement for staffing. It won't add any loading to the staffing complement, and if it works, now it is, you know, there is a caveat in that, you know, this is new technology. We are relying on the manufacturers' indicators that this will work, but we're not tied into a long-term deal with them. It's not a capital purchase, and that we've factored in the cost of the rental in the whole financial package, so that you know, as I say, our expectation is a worst case scenario is cost neutral to us going forward.
So you're capturing the whole volume. You're not leaving any residue behind that would require any other.
No.
Okay, thank you.
Zeker, we kunnen gaan. We boeien kundige analyse van jaar. Ja, jawel. Cos Bruno Coscus here lyric it binnig and scuttle at all good time. And also she the gunde die tosche it kies a chiet binnigen a hat all good time uren a time lesigte. En zijn Eilean en Siar had torg rausig an opbit lian minichte ek fastgiven hun agus dini daivi jistis an haas fikti a kisten. David.
Thank you, Chair. This report looks to recover some costs for issuing sets of wheel bins to new properties or properties that are newly occupied that don't have bins at the moment. We did a wee bit of research on this a number of years ago when local authorities started charging, other local authorities started charging for this. And we followed that up this year with another survey of all of the local authorities that we got a response from. So if you look at Appendix 1, Aberdeenshire, they only charge £31, but that's just for one bin. Angus 107, East Wren 167. So some of the other ones, Midlothian 200, North Ayrshire 200. North Lanarkshire 226, etc., etc. We're looking at this as a means of trying to reduce the costs. We, for example, the 33 new properties in Altu and Newmarket, we provided 4 bins to 39 properties, and this would allow us to take in on a similar project a cost from the developer of 9,360. It's quite, so it's getting quite clear that we're constantly looking at new housing developments, and yet, there's never an uplift to our budget to accommodate often either extension or additional routes. But I think this is a fair way to at least add on the cost of delivery of bins to etc. to new premises, and we're just following in route to what most of the other 31 local authorities in Scotland are doing at present. Happy to take any questions.
Kirstick tends to be. You.
Okay, Tapper. Just a couple of weak questions, David. When are you looking at introducing this service?
As soon as we get approval, basically, so the end of this cordless.
This afternoon, then?
Well, no, obviously we that's got to approve cordless.
And the £160 plus VAT for a set of 4 bins, that's basically you've paid that price for life, and you got bins for life.
Yeah.
For repair. What happens if somebody needs additional bins? If they've got special weight, extra waste for
if we have approved additional residual bins, for example, if there's a specific need and that gone through that approval, there's no extra charge for that, because they should only be on a temporary basis anyhow, and we should eventually be taking these ones back in. It's £130 plus VAT is what we're looking at, and obviously new properties recover the VAT. So.
Okay, thank you.
Chair, can I just ask a quick question on David? David, there are some, well, let's put it, premises where buildings are burnt or what have you. How about replacement costs?
We tend to very, very rarely seek to recover the cost of a bin from a householder. To be fair, the majority of the reasons why they've needing replaced is either they've cracked or they've blown over and they've been damaged, or occasionally they'll come off the loader when they're going into the bin, the waste going to the bin, and you end up with a bin in the bin lorry. So there are technically it should be part of a householder's sort of insurance policy or liability, but it's very rare, you know, we tend to only really look to recover costs if it's something that's obviously, you know, you used to have a problem with people putting hot ashes into bins, but there's fewer and fewer people using solid fuel with ashes that, you know, coal ash is the worst. You end up with two wheels and a bit of melted plastic instead of a bin. So, but that, to be fair, that is a lot rarer than it was when we introduced the wheelie bins.
I was just looking into inability to pay, you know, from poorer members of society.
Yeah. I think this is aimed at new houses, really. We very, as I say, we very, very rarely apply a charge unless somebody's been doing something silly like, you know, cutting holes in a bin or something like that.
Just going to ask Tom, does he do anything like that?
Who's going?
Why me?
Sugar Hallam.
Yes, yeah, thanks. Yeah, I'm nothing against this. I think it's long overdue in one sense because you are, as you say in the document here, you're honest ensuring them against, you know, the wheels go on. You repair that quite right very quickly. In fact, but one question I says, you talk about the 33 houses out in Laxdale. That's HHP houses.
Mm-hmm.
Would you charge HHP for them rather than the tenant that's going in?
Yeah. The proposal here is to charge the developer. Yeah, that's the intention. I know that some other councils charge the householder. I know in Inverness, Highland, that's the way they work. You have to when you sign up for council tax, you have to get in touch with Highland Council and order bins and pay for them. But the plan is to so that the cost is loaded onto the developer rather than the household.
That's right.
Okay, dus weer ja, wat boeilerkundige in de morgen in 3 point home. Right. Sugar on.
Sorry for being late with this, Chairman, but I've just noticed that Stornoway Trust is the subject of the next report, so I'm declaring interest in reading it.
And I got thrown yeah, and carbon, yeah. Clear, Cuspera tegen aan de diamerk tegen de konjo, agus le shen glosje in ko cuspera hun die ik asken haast die heen. So cuspera hun die ik ask, dus een aardstof ik is, agus a showers on fistrige. En kisten ik dan je bij. Ja, clear. It's in this